Ruben.
Thank you so much, TJ. Good morning, Board of Commissioners and the citizens of Douglas County. The July 7th, 2020 Douglas County Board of Commissioners meeting will come to order. And due to the COVID-19 crisis, the Board of Commissioners meeting is being conducted again with the use of virtual technology within the guidelines of the Open Meeting Act and certainly under emergency extenuating circumstances. Good morning again to the citizens of Douglas County. Board of Commissioners, due to the unprecedented COVID-19 pandemic, there will be no public comment today. However, this administration wants to hear from our citizens, and I am finding a way through a virtual process to allow them to be heard. Citizens, I respectfully request that you email your district commissioners or the county administrator or myself today. And moving forward, I will work on a plan to allow you to speak, certainly because it's been quite a while, and certainly want to hear from our citizens and take their matters under advisement. Board of Commissioners, I want to remind you, we will follow the Roberts Rule of Order. And during this meeting, I ask that you limit your discussions to 3 minutes. And if needed, you will be granted an additional 2 minutes, certainly for rebuttal if needed. Clerk, please monitor the time. And Board of Commissioners, when you hear the buzzer, please wrap up your thoughts so we can move on with our meeting. Invocation this morning, we have an invocation with Rick Martin. Rick Martin is our Director of Communications, and he will render our invocation.
Good morning, Chairman Jones, Board of Commissioners, and staff. If we may bow our heads. Our Heavenly Father, thank you for another day of life. As we are gathered this morning for our Board of Commissioners meeting, I ask for you to provide guidance and support to our elected officials. I pray for protection of our first responders and staff and employees. I pray for loved ones who are affected by this virus and pray for hope and strength so everyone will get through. In Jesus' name we pray, amen.
Amen. Thank you so much. I would like our own Vice Chairman of the Board of Commissioners this morning to lead us in the pledge, and we will follow you, Vice Chairman Robinson, if you will.
Ready? I
Yes.
pledge allegiance to the flag
Flag
States of
the
America,
United States of America,
the Republic,
and to the
which
republic
is now joining.
nation,
one nation under God, indivisible,
liberty,
with liberty and justice for all.
Justice for all. All right. Thank you so much, Vice Chairman, for leading us with our pledges this morning. Board of Commissioners, quickly we have the approval of the minutes, and then I'll move on with the presentation from our board, Cobb Douglas Board of Health this morning. Certainly want to just say, Board of Commissioners, you have the commission minutes, meeting minutes of June 16, 2020, and the work session minutes of June 15, 2020, and the executive session minutes of June 15, 2020. Are there any corrections, additions, or deletions that need to be made at this time?
No, ma'am.
Okay, being none, the minutes stand approved as presented. This morning we have another presentation, and certainly I asked Dr. Amiya Mark and also Lisa Crossman to come back and just share again, because we know we have the public that's usually viewing our meetings, our Board of Commissioners meeting, especially at a time such as this, and wanted them to provide an update regarding COVID-19 and how it has impacted Douglas County, and also some of the things that we're doing to try to mitigate the transmission of COVID-19 in Douglas County. With no further ado, I yield to you, Dr. Amiya Mark.
Thank you, and thank you for having us today. And we really appreciate all the support from the Board of Commissioners and yourself in our battle against COVID-19. We have a presentation. Rick, did you want me to drive, or did you want to drive this one?
Please, you're more than welcome if you're ready to drive.
Yeah, I can do that.
And I can be in the passenger side if you like.
Okay, that's good. Put your seatbelt on. So, all right. Here we go. So let's, all right. So we have our presentation here. Can you see it?
Mm-hmm.
Okay.
Yes.
Yes.
Great. So make sure we're on the same page. All right. So today we're going to give you a little bit of an update. We issued a public health alert last week and concerning the increasing number of cases that we were seeing throughout the state, but as well as our areas as well. And so I wanted to make sure that everybody was aware of what was happening and took all necessary steps. Oops, sorry. Oh, we're missing the little slide here. So, sorry, we're missing a slide, but it says, but if you look at the public health data that we had, you can definitely see that there was a trajectory of a very steeply increased trajectory of cases that are being seen and throughout the state as well as our district. And we'll show you some more from the district. You can also see the number of deaths here that have declined at this point, but this new increase in cases, we don't know the impact yet on deaths at this time. When you look at Douglas County, as of yesterday, you can see that we have 1,137 cases, and but the surrounding counties you see where there's definitely a large number of cases that are occurring. And just in Fulton County, which shares a large border with Douglas County, they're going at least 200 cases a day, new cases that are being added on. When you look at our timeline, we're really appreciative of the commissioners of putting the shelter in place back in March. And you could see the effect of that on the number of cases that we were seeing. And we would have an increase as we went along in May of kind of reopening the economy a little bit and continue to keep going with that. And then we were seeing an increase in cases. So back at about a little over a month ago, we had just 594 cases. And as of July 6th, we had 1,137 cases with 37 deaths that went with that. Our current conditions, this is as of actually today, we have 1,137 cases. We had 198 hospitalizations and 37 deaths. 19 of those deaths were attributed to long-term care facilities, and we have 7 outbreaks that are occurring in different long-term care facilities, group homes, churches, and businesses. The hospital data, I just received actually some more data just to my cell phone as we were getting ready to go. The Douglas Hospital currently has about 20 patients that are confirmed there, and then the number of ICU beds is actually decreased, and so they only have 2 beds that are available. So, but these are not all COVID related, but we definitely watch the availability. And these numbers go up and down, and so we continue to monitor those. The emergency department on June 29th experienced its highest one-day count of COVID-related cases that came in, either symptomatic or asking for testing due to some concerns. And so we're continuing to watch that as well. But it was a huge spike, and that spike actually correlated with some very high numbers that we're seeing throughout our district. When you go to our website, you can see that the county is laid out, and you can see where there's an increase in number of cases and just by color coding. And this is all cumulative in nature. And then you can see how our positivity rates have steadily increased. And so we have approached close to 14% positivity. And this is just our drive-throughs. So we look at the drive-through numbers and how many of those were coming back positive. And so we're about out of 100 people, it'd be about between 13 and 14 people were coming back positive. Back in the just a few months ago in the past, we would only get 3 of those, 3 out of 100, and now we're between 13 and 14. And you look at the range of ages that we see, and so this is back in April. You see we have a little bit more of a bell curve in age ranges that we would see. And now we're actually seeing the positive cases are really looking at our 20s and 30s and 40-year-olds, and the 50s stay consistent throughout. But you can see now there's a lot more younger people that are positive, and then here our older people, there are much less that are coming back positive. We're hoping because they continue to shelter as much as they can. These what we're seeing correlate in our district is also correlating with hospitalizations as well. We have younger folks that are being hospitalized, unlike having older folks previously that were hospitalized. Just gender-wise, it's similar, but we continue to have more females than males that are diagnosed. And then when you the breakdown by race
Is now exiting.
as well. So you can see that there's in Douglas County, we have more Blacks that are being diagnosed versus white. So what are our solutions? So what we've asked from our public health alert is that the medically fragile continue to shelter in place. And so stay at home unless you need to go out to seek essential services. So if you need to go to the doctor or get groceries or medicines, food, things like that. But the transmission rate is high, so continue to protect yourselves. Everybody needs to continue social distancing. 6 feet is the recommended number that you should stay away from each other. And that is also the number that if someone around you is positive, if you are outside of 6 feet for 15 minutes, you will not become a contact at that point. Face cover, we cannot emphasize this enough. And so there are multiple studies that are coming out about the efficacy of face coverings, as well as the potential impact on the economy. If we could just increase our number of people that are wearing face coverings, that the economic damage of COVID-19 will be lessened. So if you are sick, please, you got to continue washing your hands, covering coughs and sneezes, and do not go out when you are sick. We have enough problems with people who don't have symptoms that are transmitting COVID-19, but if you know for sure that you're sick, please do not go out and expose other people. Get tested and isolate if you're positive. So both parts of these are very important. So we're working on increasing our access to testing. We've already tripled the number of people we're able to test in Douglas County, and we're increasing that. We're looking, we have outreach partners that are helping us, and we should soon sign with another partner that will be able to vastly increase our testing. When you get called, please respond to the contact tracers and quarantine. This is very important because you can become positive between 2 and 14 days after being in contact with somebody that's positive. And so let's all be kind to each other. This is a very difficult time for everyone involved. And so we can only do this if we do this together and try to maintain our distance. Everybody's got to pitch in. For testing, I mentioned that. So you can get tested free at no charge through Cobb and Douglas Public Health, and it's at the Douglas Public Health Center. You do not have to have a doctor's referral. Just go online and then you with cobbanddouglaspublichealth.org, and you can get signed up for testing. I know that availability is a little bit difficult right now, but like I said, hopefully by sometime next week we should be able to vastly increase testing out in both of our counties. You can see that we have some great partners, and we are having some testing events, and we are getting even more. We just keep adding to that list. So if there's a place that we can do a few hundred tests, please let us know. We'll try to get our team out there. Okay, so I'll turn it over to Lisa for.
Good morning, everybody. Commissioners, thank you for having us again and for helping us to get the word out about the latest update with COVID and some of the solutions that we need help with by all the residents of the county. As Dr. Amiya Mark mentioned, face coverings are critically important right now. We don't have a shot, we don't have a pill that we can give our residents to help prevent this virus. And so we only have a few tools. One of those is making sure that we stay 6 feet apart. But there are a lot of situations where we cannot do that consistently. And so wearing a cloth face mask is going to be helpful to prevent the spread of the virus in case the person is contagious. So for example, I have a mask that I wear whenever I'm going to be within 6 feet of people. And we know that the virus spreads by the respiratory droplets that come out when I speak or cough or sneeze or laugh or sing. And so by me wearing this cloth face covering, I'm going to be able to keep those respiratory droplets close to me and not going out to other people that are around me or going onto surfaces that they may touch. Next, Dr. Amiya Mark. With this slide deck, and we'll make this available through the county, you can see an active link that gives you much more information from the CDC about the evidence that supports the use of cloth face coverings. And so there are only a few folks that we don't recommend wear a face covering, but for the majority of us, it is a completely effective and appropriate way to help reduce the spread of this virus. When we are out and about, we are not asking that folks wear these cloth face masks when they are in their home, when they are outside and reasonable distance from people, but when you go out in public, like to the grocery store or to an event where you know there's going to be folks that are not part of your immediate family, we're asking that residents wear these cloth face coverings at all times to reduce that spread. Okay. We have a couple of infographics that we wanted to share with you, and this will be part of the larger campaign that we're working with Douglas County government on to be able to provide residents with the resources about wearing cloth face masks. So you can see through both of these infographics that if we look at the chance of transmission up on this top one on the top left, that if you have folks who are asymptomatic but positive for COVID-19, and then they're coming in contact with an uninfected person. So if I don't wear a mask and I'm positive and I come in contact with somebody else who's not wearing a mask, the risk of transmission is tremendously high. As each of us start to wear masks, you can see that down at very low, that if we are both wearing masks, that our risk of transmission is low. It's tremendously low if we're both wearing a mask and farther away than 6 feet. And so that's the message that we want to get out to folks. Again, as I mentioned, there are some times when we don't want folks to wear masks. So for example, children under the age of 2, individuals who have some difficulty breathing, very elderly or senior adults who might be fearful and don't know why someone is putting a face covering on their face, and they may get tremendously agitated. And then in some case, there are some mental health issues where somebody will become very anxious about wearing a face covering. Maybe they're claustrophobic. So those are a few of the exceptions, but truly those are minor exceptions compared to the whole population. Dr. Amiya Mark, anything else that you want to add?
No, we're just encouraging everybody. It's the best that we have to do. And, there's a lot of activities that we all want to reopen, and, including schools and football and a lot of different activities. And the best way that we can safely get there is if we can try our best to follow these guidelines.
Yeah, I do think that's an important point. As I said at the beginning, we don't have a lot of ways to combat this virus. And we all, including public health, want to make sure that our businesses can stay open, that our schools can reopen, that my Florida Gators can be playing again against the Georgia Bulldogs. But to do that, we're all going to have to do our part, which is to stay 6 feet apart, wash our hands, and wear our mask when we're going to be in contact with folks. That's about all we have to work with. So thank you, Madam Chair. We appreciate the time.
You're muted, I think.
I apologize. Commissioner Guider, I see your hand. Do you have a question? And then we're going to move on. Commissioner Guider?
Yes, I had to unmute too. So, Lisa, what percentage of the new cases are asymptomatic, and what steps are we taking to either quarantine them, or what steps are we taking to keep them from spreading the virus?
So, Commissioner Guider, we have a few options. So first of all, we know that up to 30% of the people who test positive for COVID-19 are asymptomatic. meaning that they don't feel bad in any way, but they've just gone to get tested either because they've been informed that they're a direct contact or because they're just trying to be proactive and be safe. So a lot of people are walking around without knowing that they're positive. And so that's why we're recommending the cloth face mask and staying far apart. The other thing that we're doing is that anytime we identify an individual at a business or out in the community who is positive, we do the case investigation to determine who they've come in contact with. And then we reach out to all of those direct contacts and say, you may have been in contact with someone who has tested positive for COVID-19. We recommend that you, as a direct contact, quarantine for 14 days. That means you stay home, you don't go out, and that you really try to protect your family or other folks in your home by wearing a mask or staying far apart. And so that's another way that we're trying to reach out and connect with those folks in the community who might be a possible source of spread. Dr. Amiya Mark, anything you want to add? Okay.
And a person that is asymptomatic, they have no symptoms whatsoever, not even
Correct.
a tickle in their throat.
There are a number of people, again, up to about 30% that have no symptoms, and
30.
about 30%, and have no symptoms of any kind, and would potentially be a carrier and spread it to other people without knowing it, or doing something that they shouldn't think that they wouldn't be doing otherwise, right? If it's one thing if an individual is sick and they go, oh, I need to stay home because I'm sick, I want to protect others. But these are folks who don't know they're sick. They're not having symptoms. They're not doing anything they shouldn't. They're trying to go about their life. But because they are asymptomatic but positive, they can spread the virus.
And to complicate things further, people who do have symptoms are considered to be contagious 2 days before the symptoms even begin. And so we have people who have no symptoms that are transmitting the disease, and we have people who don't even know that they are contagious that are transmitting it 2 days before they even will pop positive with symptoms.
And so
Okay. I was going to just say thank y'all for the information, and I yield back.
Okay, thank you. Any other commissioners? I see you, Commissioner Carthen. Did you have a comment?
Thank you, Madam Chair. Dr. Amiya Mark and Lisa Crossman, can you talk a little bit about, just very briefly, about the after effects of COVID? Because I think a lot of people just have in their minds that, you know, just having the disease, getting COVID is what you don't want. Of course, none of us do, but the lingering effects, right? Because you may not die from it, but there are lingering effects from getting the virus. And I think we're not dealing with that. So I think if people could get in their minds that, yes, you don't want to get it. If you do, of course, you don't want to pass away, but passing away is not the only thing that you could deal with.
Yeah. Well, you know, we're still waiting for a lot of that to come out, but we do know about the pediatric inflammatory syndromes that we're seeing. And so there are areas in like New York and California that are reporting those. And so almost kind of an autoimmune type of inflammatory response that children are getting. And it's against their arteries and vital organs, things like that. And so that is, being the mother of two small children, that's very concerning to me. And, you know, the people that are being admitted to the hospital are younger folks right now. And so when you look, we're looking at some of our data right now is, you know, if you have a fever or a shortness of breath or a cough, you know, your chances of being admitted are higher than the people that are having lesser symptoms, and that can linger for a really long time. There are multiple reports of people that have been sick for 6-8 weeks, and you've seen the multiple deaths that have been reported, and so it's not a benign disease. It definitely will take its toll, and especially if you have, I don't I don't want to scare people, but I want people to know that people that are the medical conditions that people have that are putting them at risk are things like hypertension, high blood pressure, diabetes, obesity. I mean, we have a very high percentage of folks that are obese in our country. Those are things and lung disease for sure, and being immunocompromised. That's quite a lot of people. And so people have hypertension and without even knowing it. And that puts you at a much greater risk of having some severe complications and death from COVID-19. And so, I mean, these are the people that we're seeing they're having the most difficult time battling this disease.
And Commissioner, I think, I probably get 3 or 4 calls a day from folks who it's finally hit home, right? That it isn't an academic conversation. It really has hit home with a family member. And one of the things that keeps being highlighted to me is that as a country, we are a group of hardworking people who continue to rally through all the things that we do. And so a lot of us will go to work when we're sick, who will go to work with there's still risk. And so that's just part of our culture and our nature. The problem is that when you do that, when you say, I'm going to power through this, I'll be okay, that's all right for you personally, right? Potentially. But the fact that you could then transmit to the folks who have high risk medical conditions or who are seniors, then those people could have really serious outcomes and potentially death, or, I mean, very serious long-standing illness symptoms for months.
Right.
And so that's why I love the campaign that says, I'm wearing my mask to protect my community, right? And so it's not just making a decision about my own health that we're asking you to be conscientious about. It's making a decision to do these things to protect others in the community who might be more at risk, and to protect your community as a whole, so that we can all continue to work and continue to go back to school and continue to enjoy the things that add quality to our life. So.
Yeah, thank you. I just wanted to point that out, that it's not, in terms of life or death, but it's in terms of quality of life. And getting the virus can impact your quality of life, even if it doesn't take you to the brink of death. So thank you so much, ladies, for espousing upon that. I yield, Madam Chair.
All right, thank you so much, Commissioner Carthen. Any other comment before I move on? Again, thank you so much, Dr. Amiya Mark and Lisa Crossman today. Great presentation, very beneficial to our citizens. And I am very confident that this information is resonating as we continue, the Board of Commissioners launch our campaign to certainly encourage our citizens to continue to move forward with the 3 W's. Wear face masks or covering, wash your hands, and also make sure that we are aware of our social distancing. That's very important. So we promise to keep hammering and moving forward and being committed to saving everybody's life. And thank you again for being here. Board of Commissioners, we're going to move on to our next item. We have certainly some resolutions this morning that are on our docket, and tab number 5 is a resolution to regulate and provide for the calling of an election to authorize Douglas County to exercise redevelopment powers and for other purposes, and authorize the chairman to sign all related documents subject to final legal review. Clerk Lisa Watson, would you please read that resolution? And certainly I will call for a motion at that after you finish.
Yes, ma'am. I just wanted to point out too that we didn't do the new business, the number 4.
Okay.
I didn't know if you wanted to save that till after. Or...
Yeah, I'll come back to that once you finish.
Okay. Okay. A resolution to regulate and provide for the calling of an election to authorize Douglas County to exercise redevelopment powers and for other purposes. Whereas the General Assembly of the State of Georgia adopted a local law authorizing Douglas County, Georgia, to exercise all redevelopment and other powers under the Redevelopment Powers Law, Chapter 44 of Title 36 of the OCGA, and whereas the act also directs the election superintendent of the county to call and conduct an election on November 3rd, 2020, for the purpose of submitting the act to the electors of the county for approval or rejection. And whereas the county desires to call for the election as required by the act. Now therefore be it resolved by the Douglas County Board of Commissioners, and it is hereby resolved by authority of the same as follows. Section 1, call for election. The election is hereby called to be held. Section 2, form of ballot. The ballot to be used in the election shall be in the form set forth in the act. Section number 3, manner of election. The election shall be held in accordance with the election laws of the state of Georgia. Section 4, publication of law and notice of election. A call of the election substantially in the form attached as Exhibit A hereto shall be published in the newspaper in which the sheriff's advertisements for the county are published at least 90 days preceding the election. A notice of the election substantially in the form attached hereto as Exhibit B shall be published in the legal organ once a week for at least 2 weeks immediately preceding the election. Section 5, notice to the Board of Elections and Registration. The county clerk is hereby ordered and directed to forthwith furnish the Board of Elections and Registration and the election superintendent with a duly certified copy of this resolution with a request that the Board of Elections and Registration and the election superintendent join in the call of the election and take any and all actions required to hold the election in accordance with the election laws and the act. Section 6, general authority. The proper officers, employees, and agents of the county are hereby authorized to take any and all further actions as may be required in connection with the election. Section 7, repealer. Any and all resolutions or parts thereof in conflict with this resolution this day passed, any and all resolutions of parts thereof in conflict with this resolution this day passed be and they are hereby repealed. Effective date. This resolution shall take immediate effect upon its adoption, which is this 7th day of July, 2020. I think Chairman Jones may have technical problems.
Yeah, it seems like she's froze or something.
Mm-hmm.
Yes. Commissioner Robinson.
You want to tell Commissioner Robinson, Vice Chair Robinson?
Can you hear me now?
Yes, ma'am.
Yes.
Okay. Oh, sorry about that. Board of Commissioners, you have heard the resolution. Do we have a motion to approve?
So moved.
Second.
We have a motion and a second. Any discussion? We have a motion and a second. Please indicate when I call your name, your response with a yes, no, or abstain. Commissioner Henry Mitchell III.
That would be a yes.
Thank you. Vice Chairman and District 2 Commissioner Kelly Robinson.
Yes.
Commissioner Terenia Carthen of
Yes.
District 3. District 4 Commissioner Ann Jones Guider.
Yes.
And Ramona Jackson Jones, Chairman of the Board of Commissioners. My answer is yes. We have a 5 unanimous vote and the motion carries. Thank you, Board of Commissioners. I'm going to pivot back to tab number 4. We have an appointment of Deborah Fagans to the Cobb Douglas Board of Health and Community Service Board to fill an unexpired term effective immediately. Board of Commissioners, do we have a motion to approve?
So moved.
Second.
We have a motion and a second. Any discussion? We have a motion and a second. Please indicate when I call your name with a response. Commissioner Henry Mitchell III.
That would be a yes.
Commissioner and Vice Chairman Kelly Robinson of District 2.
Yes.
District 3 Commissioner Terenia Carthen.
Yes.
District 4 Commissioner Ann Jones-Guider,
Yes.
and Ramona Jackson-Jones, the chairman, yes. We have a 5-0 unanimous vote and the motion carries. Congratulations, Dr. Fagans, on your new position in serving with the Board of Public Health here in Douglas County and the CSB Community Service Board. We'll move on, Board of Commissioners, to tab number 6. We have another resolution, and this resolution will be read by Lisa Watson, and I certainly appreciate the Board of Commissioners giving me or providing the opportunity for me to bring this bill forth. The House, should I say, and the Senate of Georgia certainly beat us to the punch. I had it set up for this week, but they really, it makes things better. It's been approved in the House and Senate of Georgia. Tab number 6 is a resolution supporting House Bill 426, the Georgia Enhanced Penalties for Hate Crimes Act, and authorize the chairman to sign all related documents. Clerk, would you proceed to read this resolution?
Yes, ma'am. Resolution in support of the Georgia Enhanced Penalties for Hate Crimes Act. Whereas on February 11, 2020, the Georgia House of Representatives introduced a House Bill 246 known as the Georgia Enhanced Penalties for Hate Crimes Act. And whereas the June 23, 2020, on June 23, 2020, the Georgia House of Representatives and Senate passed and adopted the bill. And whereas on June 26, 2020, Governor Brian Kemp signed the bill into law. And whereas Douglas County believes anti-bias policy, public policy helps promote an inclusive environment and a prosperous community. And whereas in order to maintain an inclusive environment and a prosperous community, Douglas County must have a climate conducive to the safety and best interest of all its citizens. And whereas the passage of anti-bias legislation is important for creating a vibrant culture where all human beings are valued, respected, and welcomed. And whereas this is important to the Douglas County community as it is comprised of entrepreneurs, employers, employees of various religious beliefs, races, ethnicities, genders, physical abilities, and orientation. And whereas diverse backgrounds strengthen our state, our cities, and the entire Douglas County community. And whereas Douglas County stands firm and commits to the safety of its citizens and against hate and prejudice-based crime. Now therefore be it resolved that the Board of Commissioners of Douglas County, Georgia hereby goes on record with the Douglas County Chamber of Commerce, various other cities and counties in the state of Georgia, and the myriad of businesses and corporations in Metro Atlanta who support the adoption of the Georgia Enhanced Penalties for Hate Crimes Act, passed and adopted by the Board of Commissioners of Douglas County this 7th day of July.
Okay, thank you so much, Lisa. Board of Commissioners, you have heard the resolution supporting House Bill 426, which is the Georgia Enhanced Penalties for Hate Crimes Act. Do we have a motion to approve?
So moved.
Second.
Okay, we have a motion and a second. Any discussion? We have a motion and a second. All in, please indicate your response when I call your name. Commissioner of District 1, Henry Mitchell III.
That will be a yes.
District 2 Commissioner and Vice Chairman Kelly Robinson.
Yes.
District 3 Commissioner Tarenia Carthen.
Yes.
District 4 Commissioner Ann Jones-Guider.
Yes.
And Ramona Jackson-Jones, Chairman of the Board of Commissioners. And the answer, my response is yes. We have a 5-0 unanimous vote, Board of Commissioners, and the motion carries. And this is another great move and great day here in the state of Georgia and also in the county of Douglas. All right, we'll move on to our next tab, or should I say our next resolution is tab number 7. A resolution in support of the CDC recommendations of wearing a cloth face covering in all public places where social distancing is difficult to maintain, and authorize the chairman to sign all related documents. Clerk, you may proceed to read this resolution.
Yes, ma'am. A resolution in support of cloth face coverings. Whereas the transmission of the COVID-19 virus continues to threaten Douglas County citizens despite the efforts to slow the spread of the virus over the past 3 months. And whereas all businesses and operations reopen in Douglas County, it is critical that all citizens remain vigilant to protect themselves and their fellow citizens by adhering to the Centers of Disease Control and Prevention's social distancing, hand hygiene, and cloth face covering guidelines. And whereas scientific evidence shows that a substantial number of individuals with the COVID-19 virus are asymptomatic and that individuals who contract the virus may still transmit the virus to others before showing symptoms by speaking, coughing, or sneezing. And whereas employees of businesses that reopen are put in a vulnerable position when patrons come in without face covering. And whereas the Douglas County Board of Commissioners desires to make sure workers, customers, and the entire community are aware of the efficacy of cloth face coverings during the coronavirus pandemic, and whereas science shows that face coverings are one of the most effective means of reducing the spread of COVID-19 virus. However, CDC guidelines indicate cloth face coverings should not be worn by children under age 2 or anyone who has trouble breathing, is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. And whereas the risk of inaction of wearing face coverings are high and likely fatal for elderly persons and individuals with serious underlying health conditions, including high blood pressure, chronic lung disease, diabetes, obesity, asthma, and those whose immune system is compromised, such as by chemotherapy for cancer and other conditions requiring such therapy. And whereas, in light of new evidence, CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, especially in grocery stores, retail stores, and any areas of significant community-based transmissions to protect the safety and welfare of all Douglas County citizens. Now therefore be it resolved that the Douglas County Board of Commissioners hereby supports the CDC recommendation of wearing cloth face coverings in all public settings where social distancing measures are difficult to maintain. Passed and adopted by the Board of Commissioners of Douglas County this 7th day of July.
Thank you so much, Clerk. Board of Commissioners, you have heard the resolution regarding wearing cloth face coverings during this unprecedented coronavirus pandemic. Do we have a motion to approve?
So moved.
Second.
Okay, we have a motion and a second. Any discussion? We have a motion and a second. When I call your name, please indicate your response. District 1, Commissioner Henry Mitchell III.
That'll be a yes.
District 2 and Vice Chairman Kelly Robinson. I can't hear. Commissioner, are you unmuted?
Yes.
Okay, so the answer, yes, okay. District 3, Commissioner Terenia Carthen.
Yes.
Okay, District 4, Commissioner Ann Jones-Guider.
Yes.
And Chairman of the Board of Commissioners, Ramona Jackson. Unanimous vote and the motion carries. I need a good chuckle today, Vice Chairman. Thank you. That was good. Okay, Board of Commissioners, we certainly will be moving to the consent agendas, but Vice Chairman Robinson, I believe you want to make a motion to make something a singular item. Go for it.
Yes, ma'am. If it pleases the full board, I'd like to make a motion to pull out the pension line item and vote it independently. I think that's number
11.
11.
Mm-hmm.
And I would second that motion.
Okay, we have a motion and a second to remove line number 11 out of the consent agenda and make it a new business item. We have a motion and a second. Any discussion? We have a motion and a second. Please, when I call your name, indicate your response. District 1, Commissioner Henry Mitchell III.
That would be a yes.
District 2, Commissioner and Vice Chairman Kelly Robinson.
Yes.
District 3, Terenia Carthen. Commissioner?
No.
Okay, no. Okay. District 4, Commissioner Ann Jones-Guider.
Yes.
Okay. And Chairman of the Board of Commissioners, my response is yes. We have a 4-1 vote and the motion carries. So we will move this item to a singular space and it will be considered a clerk, a new business item, and we will vote votes solo. All right, I will start with that new business item first, Board of Commissioners, since we have pulled it off the consent agenda. And the item is authorization to amend the elective provisions of the ACCG Retirement Services Plan Agreement for certain elected and appointed officials as Class 4 employees and authorize the chairman to sign all related documents. Do we have a motion to approve? Do we
So
have
moved.
Okay.
So moved.
Second. We have a motion has been made by Commissioner Carthen and a second by me, the chairman of the Board of Commissioners. We have a motion and a second. Any discussion, Board of Commissioners?
Yes.
Yes, ma'am.
Okay. Okay. Commissioner Guider. Commissioner Guider.
Yes, as I spoke on this issue yesterday, I was concerned that it just broke out a class of employees. For instance, if say a deputy that worked in the sheriff's office for many years, he retired, but then he wants to go back and work maybe as a bailiff or whatever, then he's penalized by not being able to draw his retirement. I don't have any qualms against this, but I wish it was broader to other employees, not just elected officials. I think Commissioner Robinson called it the golden umbrella. And I just don't like giving certain people advantage over people. But also because this is about a retirement, and probably I would be one of those that might qualify. I need to clarify that I did not retire under the county retirement. I retired under the state retirement. So I'm going to abstain from the vote anyway, because of the perception to the issue. But anyway, I just wanted to clarify that, and the director can verify that for me. But I really think that the commissioners ought to expand this to other employees, not just elected officials. And that's my 2 cents on the issue. Thank you.
Okay, thank you so much, Commissioner Guider. Any other comments? Vice Chairman Robinson, I believe I heard you earlier.
Yeah, I'll be succinct on this one. I'm gonna go a little bit in the opposite direction, and I'm gonna focus on consistency of process. Okay, I have a concern that the Board of Commissioners are included in this. Okay. We're self-dealing, aren't we? Gratuitousness, compensation. Why is not a public hearing being held on this? Why do we go through such extenuating circumstances for a $200 expense account expansion, but yet we're spotting ourselves a golden parachute? Simply, I'd like to take the Board of Commissioners totally out of this and leave it as is. That would be my preference on this one, that we should, if we're going to do this, we should do this independently and let the citizens come do this. I don't like the fact that it was buried in the broader class of citizens. I yield.
Okay, thank you so much. Before I move on with the question, I already got a question on the floor. I wanted to allow our Human Resources Director, Mr. Fred Perry, to weigh in just a second, and then we'll move on for the commissions. I know we have a motion in a second. Mr. Perry, could you weigh in and certainly provide some information for the citizens of Douglas County, please?
Yes, Madam Chair, thank you for the opportunity to weigh in on this. I simply, in regards to Commissioner Robinson, would like for the citizens and all the commissioners to understand that this is not a matter of enhancing any benefit. The benefit will not be enhanced in any way, shape, form, or fashion. This simply deals with eligibility. It deals with access to your benefit, whether you are going to access it now if you choose, or whether you choose to access it later. So this is not dealing with you're sweetening your retirement in any way. And the normal retirement age for the county is 65. So you would have to be in office for a while in order to take advantage of this benefit, or be with the county for a while in order to take advantage of this benefit. In the case of some elected officials, they have served as employees for the county for a number of years, and then going on to an elected office. And that would put them in more of a position to take advantage of this benefit versus anyone who their first encounter with the county is in terms of being an employee would be as an elected official. So that, as well as Madam Guider mentioned, she is exactly right. She is retired under the state system. She does pay into the county plan as well. But from what she mentioned, she was a state employee. So I just wanted to confirm that. She had made mention of it, so I wanted to confirm that as well. But again, this is an eligibility issue. It's not enhancement of any benefits. And with that, I yield, ma'am.
Okay, thank you so much. Director Perry, thank you so much. All right, Commissioner Mitchell, you have anything? I saw you.
I just one quick question. One quick question. Fred, you mentioned
Yes.
earlier. You mentioned earlier that Commissioner Guider would not qualify for this now, or she would qualify, but based on her being a part of the state retirement or not. It just kind of threw me.
She would qualify. As elected officials, you all have
Okay.
a retirement with the county. So it just wouldn't be applicable to her previous retirement.
Understood. Okay, so she would be a part of this, and there was 18 individuals that fell in this realm of this particular program, I guess.
Correct. There are actually 20. There's 20 individuals that fall in class 4, and 6 that would be immediately eligible once if you also choose to pass this plan.
Understood. And last but not least, if by chance, as Vice Chairman Robinson stated, to include Commissioner Guider, that it should be open up for everybody, not selectively to individuals. If we did do that, what kind of impact, just rough, what kind of impact would that have to the budget?
Wow. Well, I don't want to speculate and say what it would, the impact. We can certainly, Commissioner Mitchell, go back and look at opening this benefit up to the entire, those who are eligible to participate in the retirement plan, and see what that impact would be. It would take some weighing in from the folks there at GEPCOR. And that I would have to send them some actuarial information and allow them to go through that process to give us something closer. I don't want to speculate and throw numbers out, but I'm sorry, the actuaries are saying that once you hit age 65, you are fully vested in the plan. And after that point, you don't have much of a budget impact on it. So at this point, the class 4 employees wouldn't have a budget impact. I would have to deal with their actuaries to see what impact, if any, would opening this up to the full employees, what that impact would look like. So I can certainly do that.
And the reason I say that is I hear both sides of this, and understandingly, I get it. I still always ask the other question is, if we open it up for everybody and try to be fair to everybody, how would you pay for it? And I think that's where I think what will happen is that it'll be too costly to do it.
Mm-hmm.
But I want to be open-minded enough to say, why don't we investigate? Why don't we ask the question? Or why don't we look at the numbers? Not that this is a bad program or anything of that caliber, but it's one of those, it needs to be vetted and more discussion, I guess, versus what we got on the table now with the appearance of what we're doing is not a good look. So
Okay.
I would hope this commission would probably take another deeper dive and see what that looks like, but if not, it's going to be a hard one to pass, I guess. But outside of that, thank you. Looks like you're frozen on me. Oh, you there? Okay. But outside of that, I'll yield and yield the floor back. But those are my questions.
Okay,
Okay.
thank you so much, Commissioner Mitchell. Any other comments before we move on? We have a motion and a second on the floor. Board of Commissioners, we have a motion and a second. Please, when I call your name, indicate your response accordingly. District 1, Commissioner Henry Mitchell III.
I have to say no.
Okay. Commissioner Kelly Robinson.
No.
Okay. Commissioner Carthen.
No.
Commissioner Guider, you said you abstained. Did I hear that earlier?
Yes. Mhm.
And Commissioner Jones, yes. Chairman Jones, yes. So we have a 3. The motion carries for no, to answer the question. And we have 3 no's, 1 abstain, and 1 yes. So therefore, we
Madam
move
Chair.
on. Mm-hmm.
Just one quick moment I'd like to add to this, not to the motion or anything, but to this particular topic. If Fred, if you would go back and do some research and, kind of get back with the commissioners about what the possibilities of opening it up, what the costs
Okay.
are opening it up, how would it look on our budgetary, on the budget side of things, opening it up, and kind of see, could we be fair across the board and not have the notion of looking like we're trying to do something strictly for elected officials and or appointed officials.
Okay.
So
Duly noted.
thank you. All right.
Okay,
Thank you.
you. And certainly, Fred, you'll bring this back at a later date, I'm assuming, to the Board of Commissioners.
Absolutely.
Okay,
Absolutely.
thank you. We'll keep moving. Board of Commissioners, we'll move on to our consent agenda. The consent agenda is tab number 8, authorization. Well, first of all the items are subject to final legal review. Please note tab number 8 is authorization to renew a maintenance agreement dated August 1st, 2020 through July 30th, 2021 with Doran Precision Systems in the amount of $9,975 for team driving simulators, and authorize the chairman to sign all related documents. Tab number 9, authorization to award an on-demand consulting contract to Atkins North America Incorporation, and authorize the chairman to sign all related documents. Tab number 10, authorization to award a consulting service contract to AMCOM Technical Services Incorporation, and authorize the chairman to sign all related documents. Tab number 12, authorization to execute a professional service agreement with Lionheart Consulting Group to facilitate leadership and diversity training, and authorize the chairman to sign all related documents. Tab number 12, acceptance of the Federal Transit Administration CARES Act in the amount of $2,523,816 on behalf of the Connect Douglas, and amend the budget and authorize the chairman to sign all related documents. Board of Commissioners, that concludes our consent agenda. Do we have a motion to approve?
So moved.
Second.
Okay, we have a motion and a second. Any discussion on any particular item or topic? Okay. We have a motion and a second. All in favor, when I call your name, indicate with a response. District 1 Commissioner Henry Mitchell III.
That would be a yes.
All right. District 2 and Vice Chairman Kelly Robinson,
Yes.
District 3 Commissioner Terenia Carthen,
Yes.
okay, District 4 Commissioner Ann Jones-Guider.
Yes.
All right, and the Chairman, Ramona Jackson Jones. My response is yes. We have a 5-0 unanimous vote of Board of Commissioners, and the motion carries. With that being said, our Communications Director is still on the line. He has some announcements, and then I have just a question or just an announcement to certainly and chat and dialogue with our Board of Commissioners about something that I would like to be certainly transparent with the citizens of Douglas County. Communications Director Rick Martin, I yield to you.
Thank you, Madam Chair. We have one announcement to mention. Connect Douglas will be holding a public meeting this week, Thursday, July 9th at 10 a.m. at the Douglas County Transportation Center, located at 8800 Doris Road. Direct access to the Transportation Center is available on the Connect Douglas fixed routes 20 and 40. At this meeting, Connect Douglas will explain the methodology used to establish this goal and provide a list of proposed projects that could include DBE participation during this 3-year period. The DBE program policy was adopted by the Douglas County Board of Commissioners in 1999 to ensure that DBEs, as defined, have an equal opportunity to receive and participate in DOT-assisted contracts. In addition to the public meeting, Connect Douglas will accept comments on the DBE goal through email or a letter. The mailing address is Connect Douglas, 8800 Doris Road, Douglasville, Georgia, 30134. And Connect Douglas can be reached by phone 770-949-7665 or email at connectdouglas@co.douglas.ga.us. And that is it as far as our announcements. And I yield back to you, Chairman Jones.
All right, thank you so much, Communications Director Rick Martin. Board of Commissioners, do you have any individual announcements that you would like to make? Vice Chairman Robinson?
Yeah, I'll be real quick. I'd like everybody to mark the date. Saturday, September 12th, 2020 will be our 4th annual HOA boot camp. This year it will be virtual. More details will come, but again, September 12th, 2020, it will be virtual, our annual HOA boot camp. So just mark the date. That's it. I yield the floor, Madam Chair.
Okay. Any other announcements from the Board of Commissioners? All right. Board of Commissioners, I want to start with our Board of Commissioners first, and then certainly, as I always, close out with a message to our citizens. Board of Commissioners, I chatted with each of you personally today, and the only commissioner that I didn't have an opportunity to reach was Commissioner Mitchell today, and he was actually conducting a meeting this morning, and I did not realize that. But I wanted to share with you, with the increasing community-wide spread of coronavirus in Georgia, Governor Kemp's executive orders have been extended to August 11th. Certainly, my initial proposed date for returning back in person for the Board of Commissioners meetings landed on July 20th, and it was made on the premises of the governor's original executive order, which was really the date of his original order ended on June 30th. However, of course, as we continue to make sure that we protect the safety and health of all citizens, including the Board of Commissioners and including our entire body of employees, I contacted you this morning and then certainly left a message to 1 or 2 last night, but I tried to attempt to call you and wanted to get your input and your buy-in with regarding to certainly changing that meeting from July 20th and still continue on with our virtual meetings for the next 30 days as the governors or beyond if needed with the governor's orders in place. Additionally, I spoke with Commissioner Guider and also the other commissioners as well, Vice Chairman Robinson, Commissioner Carthen, and certainly Commissioner Mitchell. I'm hoping you could you will buy in with us. And certainly there was some dialogue about the citizens being engaged and available to speak. And I've asked our county administrator to find a way so we can make sure that we solidify a methodology to allow our citizens to participate and certainly chime in with their concerns have public comment. That's very important to me. We've delayed public comment quite a while, and it's been quite a while, should I say at least 12 to 13 weeks. So in our recent planning and zoning meeting, we had public comments from the citizens, and we found a way to do it. And I'm asking that our county administrator work along with our clerk to find a way so we can make sure, and our communications department to find a way that our citizens are able to chime in and with public comment. Board of Commissioners, certainly we are in this fight together, trying to fight this virus. It is one that's very unpredictable. When we run to the right, it comes to the left. So I'm asking, certainly, I'm working at the will of the board and asking your support to allow me to move the date again, we not appear in presence on July 20th, and just again continue on with virtual meetings until further notice. I'm certainly running with the governor's orders. So I want to make sure that everybody is certainly okay with this idea, and please provide your thoughts if you feel that you're not in agreement. Vice Chairman Roberts.
Yeah, Madam Chair, for District 2,
Then I see you.
concur.
Yes.
Continue on.
Okay. Commissioners, I just need to hear your voice. So I make sure we.
Yes, Commissioner, Chairman.
Mm-hmm.
We spoke last night, and my concern was the citizen being able to access and have their voices heard too. And so moving forward with the new capability of letting them have a voice, I'm okay with it. Okay.
Okay, we're working to make sure that happens.
Thank you.
Okay, Commissioner Carthen.
Yeah, sounds good to me.
Okay, and Commissioner Mitchell, I apologize. I tried to reach you, but you were conducting a meeting this morning, and I didn't realize that. Your Parks and Recreation, are you okay with that? With us?
Yes. I just want some clarity. The public comments, there's always been a way, we can do public comments if you take a step back and go back and revisit when we did the planning and zoning with about 50 or 60 folk on to include public hearing and everything else. So public hearing has always been available. It's just that you've got to invite the public or with either a video invitation and or invite via a phone number. And I think I had Mark and the team and technology add a phone number at the bottom half of all the meetings that they can call in and be a part of it. So that's always been available to the citizens. I just thought maybe it was just your choice of not wanting the citizens to kind of have access to have comments until, I guess, whenever that time came along. The other part of this, until further notice, is what I thought I heard, is when we'll look at coming back as the Board of Commissioners, and if I'm hearing that correctly, until further notice, or till we kind of all find that sweet spot of when we think it's the right timing, or we all have dialogue as to when that date is, I guess. Did I hear that correct?
30 days is what I said initially, 30 days, and then of course we will revisit. I'm following the executive orders of the governor, and again, like I said, it's been a moving target. When he set a date, I try to give us a week or so and then try to meet the date that he talked about, and then he's moved from June 30th now to August the 11th. So again, 30 days, and then I'll come back and certainly share and bring this issue to the Board of Commissioners again, and we can discuss it. And also, okay.
Go ahead. Go ahead.
No, that's fine. That's what I was saying.
Yeah, so that's what I was looking to make sure. Are we saying until further notice? But it sounds like you're saying until the 30 days from today's date is what you're looking at.
Yes.
But even then, will there be a conversation with the commission to ensure that, okay, is that the right thing to do? Because there's a lot of other questions that goes along with just because we can, or just because the governor stated that he's opening up the state. That doesn't mean that we've got to follow his orders. So that's kind of that's on this commission that will decide on when and how we want to do this, how many masks we want to hand out, how much money we want to spend toward this COVID, and so on. Outside of that, I'm okay. But just back to the communication side of it, we've always had access. The public has always had access. The question is, we got to give them access to be a part of the meetings. Outside of that, I yield.
Okay, thank you so much, Commissioner Mitchell. Certainly the trigger was when we had our planning and zoning meeting. And certainly I did not realize, and I appreciate you being in charge of our communications component, that we had that access. But certainly, again, as it was read into the executive orders, that the citizens certainly could notify their commissioners, district commissioners, or either the county administrator, myself. I believe those citizens did that, but I certainly, we have gone on so long. I wanted to find a way, and certainly Mark is going to do that for me, work with me to see what we can do, and along with our communications team, to provide access so those citizens can call, our citizens can call in and express their concerns and provide comments. So it sounds like we have a consensus, and I appreciate you all, and we're working on a 30-day window. I could just, again, it may be a little longer than 30 because his orders end. The day is actually July the 7th. The order ends August the 11th, but I'll come back to the board. We'll chat again, and again, we'll just keep our hand on the pulse of this situation. It's moving. It's a moving target, and you know, as we spoke earlier, the community spread is becoming very exponential in the community, and we're trying to wrap our arms around it to see what we can do to canvas this problem and mitigate the transmission here in Douglas County. Well, Board of Commissioners, if there's nothing else to come, and I want to leave the citizens with this, and I'm so sorry, citizens, thank you so much again for your participation and your commitment and your diligence during this COVID-19 pandemic. We have had, this has been more than a rodeo. It's, again, we talk about, it's certainly not a sprint, it's a marathon. And I'm beginning to believe that every day because day by day, this virus is beginning to become, number one, intelligent, smart. It moves when you think you just have your arms around the virus. It sneaks away and go in a very different direction. And I appreciate all the support and all the things, should I say proactively, that our citizens are doing here in Douglas County to help prevent the transmission of COVID-19. We have a lot more work to do. We have our campaign that's being kicked off it's in progress, but it's not fully blown. And we have commercials coming out. We have billboards. We have flashing messaging boards and variable messaging boards throughout the county. We will have mail outs. We're doing everything in our minds, in our thoughts at the Board of Commissioners to allow our citizens to hopefully change behavior. It requires behavior change. Remember, I mentioned your mask. It's like wearing a pair of shoes. Find one that fits and wear it to death, or either you make sure if it's cloth, you need to make sure it's washed, or either find something that's similar in character with the type of mask that you choose. Again, citizens, we appreciate your diligence and support through this COVID-19. And stay tuned, and we love you and appreciate you. And Board of Commissioners, with that being said, if there's nothing else to come before this body, this meeting is adjourned. Thank you.